Hey, good afternoon, everyone. It's about 3 p.m., so we'll get started. Thanks for joining us today. For those who don't know me, I'm Jason Maurer. I'm a sheriff's deputy and public affairs officer with Sweetwater County Sheriff's Office. I'm also the acting public information officer for the Sweetwater County District Board of Health. I brought everyone here today for a couple different reasons. Wanted to share some new numbers and updates on COVID-19 in Sweetwater County. My guests today are Public Health Director Kim Lionberger and also the medical director of Memorial Hospital of Sweetwater County's Department of Pathology, Dr. Salette Karn. Kim's going to be speaking about the isolation and quarantine process. There's been some confusion lately when it comes to quarantine and some confusion lately when it comes to testing. So both my guests are here specifically to address those things. As I'm sure many of you on the Zoom portion of this meeting are used to this by now, the press briefing is being simultaneously streamed live to the public over the internet. So when we get to question and answer portion, please identify yourself by name and organization. Appreciate that. So I'll go ahead and get started just with some numbers updates. So from Sunday, June 21st through Sunday, June 28th, so last week, we now have 28 new positive cases. That beats the previous week's record high of 15 new cases in 7 days. So to recap, we have had 3 new positives in the first week of June, 7 in the second week, 15 in the third week, 28 this past week, and then an additional 4 today. So that brings our total to 78, if I'm not mistaken, and Kim will probably clean me up on some of that if needed. I think what we're seeing in terms of contact tracing is it's sort of a mixed bag. We have a number of our confirmed positives who are tied to close contacts with other positives. We have a significant portion of the latest lab confirmed positives who are interconnected and essentially tied to people who are spending more time in public at different events and businesses. And then we have another portion where it's not entirely clear. So it's out there in the community. That shouldn't come as a surprise to anybody. We really think that it's unfortunate that the situation has been politicized in different parts across the country. We're really trying to avoid that here in Sweetwater County. We recognize and we appreciate that some people aren't very worried about this and they want to go on with their lives, and that's their right, and we respect that. At the same time, we recognize that there are other folks, equal number of folks, a lot, or at least some, who may be at high risk, and they are worried about this, and they are concerned, and they are trying to take necessary precautions, and they are continuing to be very careful and guarded out in public. That's their right, and we respect that as well. I guess, everyone is entitled to their individual rights and freedoms, so long as they don't impinge on others' rights to enjoy the same. And I think our message is we would like people to be respectful, no matter where you fall on that spectrum, and to at the very least to please recognize that your actions and decisions, they have the power to impact others. So with that, before I turn it over to Kim, who's going to speak about isolation and quarantine, are there any questions for me? Hearing none, go ahead, Kim.
Good afternoon. Some of the concerns and issues that come around the isolation and quarantine orders are the fact that there's 2 different words, isolation and quarantine. So isolation orders are for individuals who have tested positive for COVID or are probable cases. Probable cases are individuals who have been around a lab confirmed individual and then also have symptoms that would be indicative of COVID-19. So those are our probable cases, and they get isolation orders. Individuals that get quarantine orders are those that are identified as close contacts of the lab confirmed or probable cases. And a lot of questions that we get, we explain to people when we're quarantining them that they're quarantined for 14 days from the last known contact with the either positive or probable case. At this point in time, we recommend them, if they're asymptomatic, to wait about 5 days from their last contact with the individual that has tested positive to be tested. If they are positive or if they're symptomatic, we recommend they get tested right away. Once we issue those quarantine orders, if an individual has had a COVID test and it comes back negative, it does not shorten the duration of their quarantine order. So even if you test negative, you do not come out of quarantine until that quarantine order is finished. And those quarantine orders have the dates on those. So we explain that multiple times to people that we issue quarantine orders for, and inevitably it seems like they still get their tests done and they're negative, and then they're always asking, do I get out of quarantine now? And that is not the case. The reason behind that is because the incubation period for COVID-19 can be anywhere from 2 to 14 days. And we've had multiple instances where individuals test negative initially, and then they test positive after that initial test came back negative. And so that is the reason behind quarantine for 14 days, is to get past that incubation period. Things that are encouraging this last week, although we were really busy with lots of contact tracing and getting issued the quarantine and isolation orders, is that a good majority of the ones that came positive last week were already in quarantine from previous cases. And so we look at those as wins where we have stopped the chain of transmission, at least for those individuals, and that they weren't out in the community continuing to spread COVID. We understand that the majority of our cases have had fairly mild symptoms that have been able to be managed at home. And so we look at it more of an economic burden at this point in time. We did just release one individual, and with his permission, I won't identify him by name, but it impacted his business at a loss of about $1,500 a day, because his staff was quarantined in addition to him because they were identified as close contacts. So he was unable to keep his business open because of the close contacts that were also quarantined, and it came at an economic cost for him. And he said, when he goes back to work and opening things up, he's definitely going to look at how his business practices are being done so that they can distance from each other. If they can't, then they will mask to reduce the risk of transmission. They will look at things within their business to avoid multiple contacts with different people so that there's not transmission going on. And he is he's 10 days out from his from when he was isolated and tested, and he has pretty fair amount of fatigue still. So he said it's not just like a normal, I'm sleeping for, a 15, 20 minute nap. It's 4 to 5 hours of a nap because he's just wiped out. And so those are some of the things that we have encountered with our isolation and quarantine. But the biggest takeaway is that individuals that are quarantined, even if you have negative test results come back, you don't come out of quarantine until that full 14 days from the last contact of the positive is away. Unfortunately, the quarantine and isolation orders are one of the only things that public health has in our toolbox to kind of help mitigate and keep this from spreading super fast, where it might then impact the hospital where they could be run with multiple cases. And so we don't have a vaccine. We don't have any other therapies that would help with this illness. And so that really is the only thing that we can do to kind of mitigate that spread. With that, I would take any questions that anyone has for me.
Do we have any questions for Kim?
Hello, my name is Caleb Smith with the Rocket Miner newspaper.
Just for clarification,
of the 43 cases that have tested positive over the last couple of weeks, are they relatively connected?
Yes, they are relatively connected. I don't have a specific number where I could tell you 5 of them are, or 10 of them are, or 15 of them are, but the majority of the ones that came in last week were tied to other cases in one way, shape, or form or another. And so, like I said, we had multiples that came through that were already quarantined in connection with other cases. And so at this time, the majority are tied to other cases. There are some that we don't know where they've picked it up yet. But yes, to answer your question, a lot of them are interconnected.
I believe Caleb with the Rocket Miner had a question. Go ahead,
Yes.
Caleb.
Thank you. One question that I've heard more than one person ask are, what are the consequences if someone does not follow the isolation or quarantine order?
That's a good question, Caleb. So the isolation and quarantine orders are under state statute, and they are a misdemeanor. And it would be up to the county attorney to proceed with how he would prosecute, but it can include a fine and jail time under that statute.
Hey, Kim, it's Braden from Sweetwater NOW. Just a quick question for you regarding masks. In other parts of the country, they're starting to be required by law per se, but what is kind of public health's viewpoint on masks, and are we headed in a similar direction to that?
So I think, and I might have said this before, but it's worth mentioning again, that one of the disservices that happened at the very beginning of this was that we said that masks don't protect you unless you have like an N95, and those are more for healthcare providers to protect them while they are treating individuals that they know are COVID positive. When we're talking about masking and face coverings at this point in time, we are more referring to protecting those around you. And so if you wear a mask, you're obviously containing any vapor or droplets or anything that are leaving your mouth. So if you're not able to maintain distance from individuals, if you have a mask that you're wearing, it's true, you're not technically protecting yourself with simple face coverings or masks, but you are protecting those around you who you don't know are immunocompromised or not, or at high risk of things. And so if I'm going out somewhere public, my philosophy is to do no harm. And so I will wear a face covering because I don't know if I'm an asymptomatic spreader. I don't know if I am sick and I don't know that it yet. So I will wear a mask to contain my vapor, my droplets from going to anybody else. There is an analogy with peeing on people. I don't know if you've seen that one, but maybe I'll take this opportunity to say, if you have two people and neither of you are wearing pants and one of you pees, the chances that both of you get urine on you are significant if you're standing close to each other. If the person pees their pants and they have pants on and you don't have pants on, the chances are you still might get some on you. If both of you are wearing pants, he's going to be wet, but you're not going to be. And so it's kind of a really crude analogy, but I don't know how to make it simple for people to understand. And it has nothing to do with my immune system is good enough to fight it off, because I feel like my immune system is probably good enough to fight off COVID and that I wouldn't have a serious problem with it. But I can't guarantee that the people around me would have the same thing. So masks, if you find one that fits you well and is comfortable, that you're not touching and messing with, they are effective at containing your germs to you and not spreading it out into other people.
I just have to say that Kim and I have been at this nonstop for 15 plus weeks, and we've been trying to fit that urine analogy in, and congratulations, Kim. Well played.
Sorry if it was offensive to anyone.
Any other questions for Kim? Thanks, Kim. Hearing none. Also have with us today, as mentioned at the beginning, Medical Director for Sweetwater Memorial's Department of Pathology, Dr. Celeste Karn. She is all things COVID-19 testing. She unfortunately doesn't have video, but we got her here on the phone. So I'd like to turn it over to her at this time. Go ahead, Dr. Karn.
Hey, thank you very much. That's a hard act to follow, Kim. I don't have any urine stories. But I did want to follow up on something Kim said, because we spent a lot of time preparing for the sick COVID patients to come in and protect our staff from the sick COVID patients. And we've done that successfully. COVID has not gone from any of our patients to any of our employees. But we have had employees that have brought it in from the outside world. So now we're kind of shifting our focus and making sure that we're protecting ourselves against one or with one another, because we can't afford to lose any nurses. We can't afford to lose any pathologists. There's only one of them. We can't afford to lose any surgeons. So we're working hard at keeping socially distanced, and we're required to wear masks at all times, unless you're in your office alone. And we've got to stick to that because we want to be here to serve our community. We can't just plug and play. We can't get extra people. So on to testing. First thing I wanted to do was talk about what's available. Here at Memorial Hospital, we have drive-through testing at the swabbing station, Monday through Friday, 7 to 7, and weekends 9 to 2. So we're open every day of the week for swabbing, for testing. We also have a walk-in clinic Monday through Friday, 11 to 7 p.m. Rapid testing is available for symptomatic patients through the walk-in clinic. I've been talking to Dr. Fauntleroy at Castle Rock, and they also have drive-through testing Monday through Friday, 8 to 12 and 1 to 5. They have a respiratory clinic by appointment Monday through Friday, 8:30 to 5:30 p.m. And we are going to share our rapid testing with them so they can also do testing for symptomatic patients through their respiratory clinic. The important part about the testing is the only diagnostic tests are the molecular tests. And molecular is the key word here. They're sometimes referred to as PCR or nucleic acid tests. These are the only tests that you can use to diagnose the SARS-CoV-2 virus that causes COVID-19. The antigen test and the antibody test cannot be used for diagnosis. And we'll talk about those a little later. Patients with symptoms should be tested immediately, and they should self-isolate, like Kim said, until their results come back. Patients that have been exposed to others can wait a few days, and I think Kim said about 5 days. You got to let the virus incubate for a little period of time before we can catch it. So we follow public health guidelines. Currently, we have diagnostic molecular tests that we send out to the state, Wyoming State Department of Health, to ARUP, and to LabCorp. These send-out tests take anywhere from 2 to 7 days. Most of them are closer to 2 days. The nurses and I then call the results to the individuals, or we give the results to public health so they can deal with them appropriately. This is sometimes a bottleneck, and this frustrates individuals. We apologize. We're trying to get back to you as soon as we can. People can call the nurse hotline for results. The triage or the nurse hotline is open 24/7. I think they're always got it, so they can call results there. So all of our patients that come in for surgery are required to get this nasal pharyngeal swab for the SARS-CoV-2 virus prior to surgery. That is really for the benefit of the patient and the benefit of the people taking care of that patient. Patients with COVID-19 do not do well under anesthesia. They sometimes have severe respiratory distress, and it's sometimes hard to get them back off the ventilator. So we want to make sure that all of our patients have that testing done before, just in case they're an asymptomatic carrier and they don't know it. We also have the ability to do some molecular tests, diagnostic tests in the hospital. These are somewhat limited. Some of them are done in a few minutes, some of them take a few hours. One of them you potentially have heard about is the BioFire Respiratory Viral Panel. This is a really cool test. It detects a number of different viruses like flu, respiratory syncytial virus, metapneumovirus, multiple others. The problem with the test is it's expensive. So it's about $1,200. Some insurance will pay for it. So we have used that, especially for children. The other test we have in-house, and we just got it, is the Cepheid test. This is a great molecular test. Unfortunately, we only have a limited supply, so it's restricted for use for patients in the hospital. So patients that are coming in for emergent surgery, for example, would get this kind of molecular testing performed. The other molecular test we have in-house is the Abbott ID Now. This is probably the test you've heard most about in the popular press. This test only takes a few minutes. It's only supposed to be used on patients with symptoms, and that's fever, cough, shortness of breath, muscle aches, headache, nausea, vomiting, diarrhea. Unfortunately, with this test, there's a number of false negative tests. Anywhere from 15 to 50% of individuals that test negative may actually have the virus. So we have to back this up with a nasopharyngeal swab for one of our other molecular tests. So if you get a rapid Abbott ID Now, you should be getting 2 nasal swabs, one nasal swab and one nasopharyngeal swab. Most people don't like that much, but that's what we need to do to make sure we're on the right track. I'll say just a little bit about antibody testing. We do have antibody testing available in the hospital and at our reference lab, ARUP. It cannot be used to diagnose COVID-19. It can only tell you if you potentially have had it in the past. From what I have seen, there are very few positive antibody tests. So it looks like we in Wyoming have not been exposed and have not had it in the past. And then finally, this keeps coming up. I just wanted to mention briefly saliva tests. There is a study going on, I believe in Europe, in Britain, on saliva, and we do have some saliva tests that have gone for authorization under the FDA in this country. We do not know how good these tests are. They certainly would be easy to do, so it'd be a nice thing. But we don't know enough about them yet, so we do not have them available here. We'll continue to look at them and to see if they're worthwhile, because right now we just don't know. Any questions for me?
Any questions for Dr. Karn? Well, hearing none, that's all I have for today, unless Kim would like to add any final thoughts.
Trista, my partner in crime, let me know that there was a couple questions in the Facebook concerning close contact and quarantine, just clarifying that. So the recommendations that public health has been putting out for months at this point, maintain a 6-foot distance, sneeze into your sleeve, cough into your sleeve, those things. You are defined as a close contact if you are within 6 feet for more than 10 minutes of an individual. And that is what will quarantine you. So you'll be quarantined for 14 days if you're identified within 6 feet for more than 10 minutes. So that is what the definition of a close contact is. That is what happens when you're quarantined. So when we are saying those 6-foot distances, spoiler alert, it actually will keep you from being quarantined if you're able to maintain that distance. So someone just needed that clarified. So I just wanted to clarify that for an individual. But that's really all. That's all I have. Although I see a question from Dave Martin with the Green River Star newspaper. He emailed me. His computer doesn't support Zoom. He's asking, do you think it's safe to say we're not seeing a second wave of infections in Sweetwater County despite the higher number of COVID confirmations that have been announced? I would say when we're talking about a second wave of infections, so initially we were pretty close down and people weren't really interacting and being around people very much. And so that first first little piece of this pandemic, I think 11 total is what we had until orders kind of loosened up and people started to interact with more people. So we're definitely seeing more infections because people are interacting with people more, and they are interacting with people who they're going places when they're not feeling well. They're sick for a week before they even consider getting tested. So they're having a lot of contact with a lot of individuals while they are infectious. There's a lot of people that aren't distancing from one another. And so as far as a second wave, it's anticipated that we're going to have more cases, and that's not unexpected. Our goal though really is to make sure that we don't have so many all at once that people are then getting sick and needing hospital care, and there's not the resources to take care of them. So right now we're doing well. And when you look at the overall numbers and you say, why are we worried about 78 people out of 40,000 people? And I think that's something that's valid to think about and consider, and we do consider that. But you never know when 78 cases are going to turn into 1,000 cases super fast, just by people completely disregarding some of these recommendations that keep people from spreading it exponentially. So I don't know if that answered
Kim?
question.
Kim?
Yes, Karn? Yeah.
I'd just like to tag on to that. Currently at the University of Utah, they are near capacity, that even though they opened a new COVID wing, and that for us means that it may be difficult for us to transfer patients from here to there. This was always one of our biggest concerns because we want to take care of our population of people. We can do a great deal here, but we can't do everything. So we don't want to get sick because we may not be able to transfer people there for a higher level of care that may be necessary at that point in time.
Yes.
Thank you, Kim. Thank you, Dr. Karn. Are there any final questions?
Yeah, I've got one, Jason, real quick. Again, Braden from Sweetwater Now. Kim, just to kind of ask you a little bit more about those who are given the quarantine or isolation orders, are those required or are they more of a suggestion? Sometimes we get people messaging us, telling us that some of these people may or may not be staying in quarantine. So I'm just curious if that is a recommendation or a requirement, and if you guys check on them to see if they actually are in quarantine.
So it is a requirement that they stay on their property boundaries for the duration of the isolation and quarantine orders. And when we say property boundaries, we mean we issue the order for the physical address that they're at right now. So if they have a cabin or they're going to go camping, that still is not in compliance with what the actual required isolation and quarantine order mandates. Fortunately, we do not embed trackers into anybody. I don't think anybody wants that to happen, but really we contact people the best we can with the manpower that we have. When we issue isolation orders, we follow up on them. And when it's time to release them from isolation, we make sure that they fit the criteria to be released from isolation, meaning they don't actively have a fever or they don't have active respiratory symptoms that aren't improving. As far as individuals that are on quarantine, we have to take people at their word. If people know that they're out breaking quarantine and they have proof and they want to call and tell us, that's really all we can go off. But we don't call everybody every day and say, did you leave your house? Did you leave your house? Did you leave your house? We don't do that, but they are required. They're not a recommendation. They are punishable per statute, and the county attorney will prosecute if we know people that are breaking quarantine and we are able to provide that to the county attorney. Did that answer your question?
Yeah, it did. Thank you so much.
You're welcome.
Anything else? Okay, well, I really appreciate your time, Kim. I really appreciate your time, Dr. Karn. Thank you, everybody who's on the Zoom portion of this meeting, and thanks to everybody who tuned in on the internet. We'll be in touch. I hope everybody stays safe and stays healthy. Take care.